Lovely for everyone to join us, thank you. So as Chloe said, what I'm going to do is just sort of talk a little bit initially, talk you through some slides, a little bit about anatomy of the core and pelvic floor, talk a little about generally a little bit about exercise, and then we're going to do a little bit of a practical session. I'm going to do some demonstrations, you can join in or not, it's entirely up to you. And then I really want it, we're going to stop recording, and at the end we're going to have a sort of Q&A, so I want you to feel like you can ask any questions that you like at all. So if anything pops up, just write it down or store it, and then we can discuss it afterwards. You can come on camera or you can pop it in the chat. Okay, so let me just click through this. So a little bit, Chloe's already introduced me, a little bit about my experience. I've got 30 years experience in the fitness industry, and I went through abdominal surgery in 2010, and I live with a colostomy bag, which I've had for 12 years. And when I was going through my surgery, I was really surprised that there wasn't any advice or recommendations on what to do after surgery. So when I started doing a lot of research and chatting to other people who'd had abdominal surgeries for all sorts of different reasons, I found that a lot of people said the same, and they kind of feel like you've had abdominal surgery, you've had this surgery to sort of treat your cancer, and then suddenly you're left without any guidelines or any kind of information on what's safe and what you can do and can't do. And we know that after abdominal surgery, rehabilitation is incredibly important, but it's really not an area that's talked about very much. So that's become my absolute passion. So it's a real pleasure to be here and to be sharing this with you tonight. So a little bit about me. I'm a runner, and I like sort of getting out in the hills and mountains and things. As I said, I've had a colostomy bag for 12 years, and I just try not to let it stop me living my life and getting out with my kids and my dogs and just doing things. And I've just run my 59th marathon this weekend. So, but that is something that I do. It's what I love. I'm not saying that anybody needs to go and run marathons. I'm deeply passionate about just getting people moving and doing the things that you love and getting you back to living your life and doing daily activities, going to the shops, picking up your kids, picking up your grandkids, whatever it is you love doing, and feeling safe in your body to do that. So I'm going to talk briefly a little bit about just exercise in general and kind of what we mean by exercise. So the first thing to sort of think about is that any kind of exercise is safe before, during and after any kind of cancer treatment. So the world of exercise oncology is becoming really well researched, and we've got lots and lots of really good evidence about the importance of exercise and movement in the rehabilitation process. So obviously, you know, that's going to mean different things to different people, but the most important thing to know is that it's safe. And really it forms an essential part of recovery and treatment. So particularly after any kind of abdominal surgery or hysterectomy, however that's been done, the core and abdominal and pelvic floor muscles need some sort of rehabilitation and recovery. So we need to be thinking about that. So let me just get rid of this. It also helps to combat some of the side effects. So for those people who are having any kind of additional treatments, any chemotherapy, radiotherapy, we know that exercise can help to combat some of those side effects as well. And with certain cancers, being physically active post-cancer diagnosis can help reduce the risk of recurrence. But it's not just recurrence, it can actually help reduce the risk of developing other types of cancer as well. And I think most of all really is this last one, where it can really help with your mental well-being and sense of control. So giving people some sort of rehabilitation through movement, whatever that looks like, can be really powerful to give you a sense of control back at a time where you're feeling really vulnerable. So I'm not talking about running marathons post-surgery, just to be super clear. I'm talking about gentle rehabilitation, abdominal and pelvic floor and core exercises. When we're dealing with a diagnosis of cancer, when we're talking about exercise, we need to be thinking about the priorities and how exercise fits around that. So if you've been very active before your diagnosis and your surgery, your relationship with exercise may be very different. And if you've never been very active at all, it's really looking at how you can introduce some exercise and movement into your lifestyle in a safe and appropriate way, and what that means for you. So we need to be thinking about doing some specific exercises after surgery, and I'll come on to that in a second, because that's the core and pelvic floor stuff, which is super, super important. One of the most important things for women who've had a hysterectomy is really this sort of concept of it being menopausal and managing muscle mass. So we know now that for women who are menopausal and postmenopausal, one of the most important things that we can do for our health is to maintain muscle mass. But unfortunately, when you've had surgery, you're often told not to lift things heavy, and that is appropriate for the first sort of immediately acute post-operative phase, but that doesn't need to stay in place forever. What we need to do is learn how to lift heavy things appropriately so that we can maintain muscle mass, because that improves our bone density and helps manage our body compositions, the balance between body fat and muscle within the body. Now, bone density and muscle mass are really important to reduce osteoporosis, but also to reduce risk of falls and frailty as we age. So for me, the most important thing of any kind of rehabilitation is giving you the confidence that it's safe to do resistance exercises in a way that keeps you independent and strong as you age. So having a reduction of fatigue and managing fatigue, and what people often talk about is after surgery and after any kind of treatment, this kind of accumulative fatigue, and the right dose of exercise and appropriate movement can really help with that. And I'm talking about maybe just a 10-minute brisk walk or something like that. We're not talking about going to the gym necessarily, we're talking about what feels right for you. And I think, like I just touched on, really, for me, a lot of my patients and clients, movement helps to restore confidence, and it helps with the whole cancer diagnosis. So it can help people feel less vulnerable within their body and just to feel more empowered. So it's that kind of recovery which is really important. And certainly survivorship and reduced risk of recurrence, but also reduced risk of other cancers and other comorbidities. So things like diabetes and heart disease and those other conditions as well. And rebuilding body image and rebuilding confidence. And I know myself, I've had 5 abdominal surgeries, and I know myself how that impacts your body image and your body confidence. You know, your body image isn't just how your body looks, it's how your body feels and how it operates. And when you feel vulnerable because suddenly your body's let you down because you've had this diagnosis, that can be really difficult to deal with. So the work I do with my patients is around using movement, using clinical Pilates, and using appropriate exercise to rebuild that body image and that body confidence, so you feel less vulnerable in your body. So just really quickly, some sort of tips. And I said a minute ago, a 10-minute walk is all you need. So really 10 minutes sort of is a really good baseline. 10 minutes of brisk walking or something where you get a little bit out of breath and it's a moderate intensity for general health is really what we need to be doing. And that's sort of, 10 minutes a day, more if you can, and finding things you enjoy. So making it social with friends, being outdoors, doing something with music, walking with your dog, going dancing, being with friends. And it doesn't have to be painful to be effective. We need to rethink what we mean about exercise, because little and often consistent gentle movement is far more appropriate for us as we're recovering from treatment and surgery. And really this concept, and this is really for the whole general population, not just for anybody with a cancer diagnosis, but to sit less and to move a little bit more. So the recommendations for people with who've had a cancer diagnosis is during treatment or just after surgery to be thinking about something like around 30 minutes in a session, if you can, about 3 times a week. And that's a recommendation. So that could be 3 30-minute brisk walks, but building up to a little bit more than that, including 2 strength sessions. And that's really what we need to be thinking about for good health. Now, what I mean by a strength session is just sort of resistance exercises. So things like you can even use bottles and cans at home, just something that creates some resistance for your muscles to build. That's really super important strength in your body. Pilates and yoga starts to do that as well. And even just kind of activities around the home can do that. But the message after abdominal surgery and after hysterectomy is often not to lift. But that is just that the post-acute phase. So one of the things we need to do is to rebuild the core and rebuild the pelvic floor so that we can do strength training safely and we can lift things safely without straining the pelvic floor and the core. And really the overall message is just to thinking a little and often approach, and something is better than nothing, and really just do what you can. So don't feel overwhelmed that you have to try and meet these guidelines. Just think about doing something little and often. So these guidelines are published by the World Health Organization, and these are the sort of guidelines for good health in terms of reducing risk of disease and just what we need to be doing physical activity wise. So I was talking earlier about how we need to sort of rethink our relationship with exercise and movement. So whenever I ask somebody about what do you think about exercise, they talk about going to the gym, lifting weights, going running, swimming, all the things in the grey box. So that kind of classic exercise picture. But actually, what I think about is exercise as well is walking, core rehabilitation exercises, clinical Pilates, just getting moving, some light strength and conditioning. And that can be things like sitting in a chair with some bottles or some little hand weights, that kind of thing. So we need to be thinking about things in the pink box to start with and moving towards the grey box if you want to, but equally, let's just get started with some of the things in the pink box. This concept of rehabilitation, movement and physical activity is super, super important. And of course, there's a big difference between the type of surgeries you've had and how frail or other medical conditions that you might have. So if you've had very a non-complex surgery and you're not particularly unwell, you don't have any other conditions, your rehabilitation will be slightly different to somebody who's much more unwell, maybe older and frail. So we need to be thinking about the person as well as the type of movement and physical activity that you are doing. So if we think about post-surgery and post-hysterectomy, what we need to be thinking about is this kind of process of recovery. And so everybody starts at the bottom of this triangle where we're talking about core, pelvic floor, and some gentle strength work around that area, and starting to build up some walking and then daily activities where we're starting to do things around the home, lifting the kettle, making a cup of tea, kind of starting to do normal daily activities around the home. And starting to move towards kind of housework and those sorts of things, laundry and all the things that we need to be a little bit careful of initially. However, the core and working the pelvic floor will enable you to do those things more safely so that you're not overstraining the pelvic floor and you're not overstraining the core. So that's why it's really, really important to do it post-surgery. Now, the guidelines are that we can start to do these sorts of movements, and I'll show you in a minute what they are. They're really, really gentle. And these sorts of movements within sort of around a week post-surgery. Because we're talking about super, super gentle rehabilitation physiotherapy exercises. We're not talking about the types of core exercises you might see someone do in the gym. What that does, when we've got that core working really well for us and sort of rehabilitated, we can then return to those daily activities more safely and feel much less vulnerable. So if we think about the rehab process after surgery, we need to think about restoring function to the pelvic floor and core. We're not talking about strength at this point. We're talking about restoring the ability of the deep core muscles to coordinate and to work and to contract at the right time for us. So that deep core sort of cylinder, if you like, that's deep within the body, pelvic floor, diaphragm, and the deep layer of abdominal muscles, that's what I'm talking about. So we restore function of that through the correct exercises and diaphragm breathing. And that's what I'm going to show you tonight. And from there, once that's in place, then we can start to move into strengthening things. So we can start to add some strengthening exercises to the pelvic floor and the core. We can add some endurance, some daily activities. And then from there, depending on your lifestyle and the types of activities you enjoy doing, we're moving further into more traditional fitness core exercises with maybe modifications, but into kind of getting back to normal activities. And if you want to do some sport and physical exercise, more traditional exercises, moving that way into that. So really that's the kind of process. So I want you to think about what we're doing is restoring function of the pelvic floor and the core. So what does that look like? So I want you to think about your deep core as like an onion. So we've got this deep, deep layer. So peel off all the layers of the onion. We go right down to the very center. And this is the sort of epicenter of what we need to be focused on first of all. After surgery, this can become disrupted. So the deep core is this diaphragm at the top, pelvic floor at the bottom. We've got a muscle called the transverse abdominis, which wraps around, but is also attached to the diaphragm and the pelvic floor through sort of fascial connections. And then we've got muscles in the back called the multifidus. Now, we're probably all aware of doing pelvic floor contractions and learning how to do those. However, we need to make sure that that's working in a coordinated way with the diaphragm and these transverse abdominis muscles, because the whole core works as a unit. It doesn't just work on its own as an individual pelvic floor. Nothing works in isolation. Everything's attached to something else. So because it's attached to the diaphragm through this internal core, we need to be thinking about how we breathe. Now, post-surgery, what I see with a lot of my patients is people have a bit of a dysfunctional breathing pattern. So they're maybe not breathing deeply enough into the diaphragm, we're breathing too shallowly into the chest, or we're breathing too deeply into the abdominals. So that's what I'm going to teach you, is this kind of rehabilitation breath. So here we have the core, this sort of anatomy. And I want you to imagine it's almost like a big sausage balloon inside of us. And we've got the pelvic floor at the bottom and the diaphragm at the top. And they work like the top and bottom of a lift. So imagine that lift inside of you. And as the diaphragm moves, the pelvic floor moves with it. So think about your pelvic floor like a second diaphragm. So as we breathe, and we do what's called a purposeful exhale, and we're going to go through that and I'm going to teach you that in a moment. What will happen is the lungs empty, the breath comes out, the pelvic floor and the diaphragm lift, and you get an automatic tensioning of the abdominal wall. So we get this contraction. So when I'm talking about retraining function of the core and the pelvic floor, this is what I'm talking about. We need to learn how to get the muscles all talking to each other and retrained before we even start thinking about sort of more traditional core exercises. So let's have a little look at what this feels like. So if you're just sitting watching this, I want you to sit up nice and tall. I'm going to teach you a diaphragmatic breath and learning how to get this engagement. And then I'm going to do it in standing, and then I'm going to do it lying on the floor. So you can join in with any of these movements depending on how you're feeling and if you've got some floor space. So the first thing is we're going to bring our hands around our rib cage, and I want you to feel your sort of ribs sort of at the bottom. Try not to let your shoulders lift. It's really important to relax. So what happens after surgery, we often breathe into the chest really high up, and actually the diaphragm then goes to sleep. And if you think about that, if the diaphragm's not working properly, that whole core isn't going to work properly. So let's just sit, and you can just listen to me, and I invite you just to close your eyes and just see how this feels. So we're going to take a breath in through the nose and feel the rib cage open wide into your hands. And then breathe out through your mouth with a purposeful exhale, not too hard, and feel the rib cage come back down. Let's do that a few more times. Breathing into the ribs, open them up like a big umbrella, and exhale, and feel like the ribs are coming back down again. Let's just do that a couple more times. So breathing in. Now you're going to feel your abdominals maybe sort of move out a little bit, and maybe the pelvic floor will move down a little bit as well. And then breathe out and feel the rib cage come back down again. Now, this time I want you to think about making that exhale a little bit longer and a little bit more purposeful. So it might sort of look a little bit like this. So it's long and it's slow. So we're going to take a nice breath into the rib cage. And then we're going to take a longer exhale through the mouth. Keep pulling those ribs down. Fully empty your lungs. And I'm hoping that you'll now start to feel this automatic tensioning of the front of the abdominal walls, this transverse abdominis, which starts to contract as the diaphragm moves back up. So let's try that again. A nice inhale. Let's count for 4. And out for 6. Pull the ribs down, empty the lungs, and start to feel a tensioning of the abdominal wall. It's not very much, it's very subtle. We'll do one more. Inhale for 4. And exhale. Feel the tensioning of the abdominal wall. Fully exhale. And see now if you can start to feel the pelvic floor coming up as well. And then just completely relax. Okay, I'm going to talk you through now how to consciously contract the pelvic floor. So we're still seated. I want you to think about being nice and tall. So your rib cage is stacked over the top of your pelvis. We're not lounging back in the chair, we're nice and tall. And this time as you inhale, I want you to see where the breath goes. We want it to go into the ribs, but can you feel a little bit down into the pelvic floor as well? Like you're feeling a little bit of sort of downward pressure, not much, just a little bit of downward pressure. So imagine that big sausage balloon inside of you, that whole sausage fills up with air equally. So the ribs will open, you might feel a bit of downward pressure and a little bit of abdominal wall moving out. As you exhale, this time, I want you to see if you can get the contraction of the pelvic floor on the exhale. Now, a lot of women will hold their breath when they try and do a pelvic floor contraction. We mustn't do that. What we need to do is exhale and contract the pelvic floor at the same time. And if you look at this image of the anatomy, you can understand why, because it needs to work with the diaphragm. So, visualizing the pelvic floor, that this kind of a sort of sling of muscle at the bottom of the pelvis. And I want you to imagine that you are contracting the back passage. Let's just work on the back passage to start with. So let's just take a nice inhale, relax everything. Inhale. Exhale, the ribs come down. And as you're exhaling, contract your back passage and see if you can draw the pelvic floor up inside. And then relax and let it go. Good. Let's try that again. So we inhale. You're filling that whole sausage with air. Exhale. Ribs come down. And see if you can feel your back passage contract, close, and pull up inside. Good. And then relax, completely relax, and let it go. So it's really important to relax the muscles between each contraction. So a lot of women will make the mistake of contracting, half letting go and contracting again. It's really, really important to contract, get as strong contraction as you can, and then fully relax and let it go, which is why the breath is so important. So let's try that again. This time, I want you to see if you can get the back passage and then bring it to the front and contract the front passage as well, like you're trying to stop yourself from having a wee. So let's try that again. Nice breath into the ribs. Feel the air fill your body. And then exhale, ribs come down, feel your back passage contract and bring it to the front. So the whole pelvic floor is contracted. And then relax and let it go. Good. Do that one more time. Breathing in. Feel everything fill. And then exhale. Ribs come down. Get the back passage first and then get the front coming up. And hold. 3, 2, 1. Relax and let it go. Now, it's a secret exercise. So if you find yourself bobbing up and down on a chair, you're using your glute muscles in your bottom instead of your pelvic floor. Your pelvic floor is it's a secret exercise, so no one should be able to see you doing it. So if you're tensing and holding, squinting your face and holding your shoulders, you're not contracting the pelvic floor properly. So, super, super important that we get the exhale with the contraction of the pelvic floor. So let's move that along a little bit. Let's talk about how long we need to hold this contraction for. So we ideally want to try and hold the contraction for around 5 to 10 seconds, ultimately 10. That's still quite a lot for some people. For some people, it's just enough just to get the contraction and let it go. That's okay. Build up to a 10-second hold. So let's see what that feels like. So we're starting in a seated position, still again. We inhale. The ribs come wide. We exhale. We get our pelvic floor contraction, bring the back passage up, the front passage up, hold. I'm going to hold for 10, 9, 8, 7, 6, 5, 4, 3, keep breathing, 2, and 1, and then let it go and relax. Good. That's quite a long time. So what you might find is that your pelvic floor starts to feel like it can't hold it that long and everything tenses up in your body. If you're feeling that, let it go. You can hold a nice strong contraction. 3 or 4 seconds, hold it, relax, repeat. The very important part is the relaxation between each contraction. So this is what we call a nice slow, long endurance hold. So we want to be building up to, wait for it, a set of 10 seconds, 10 times, twice a day. That's the ultimate goal. Now, it doesn't matter if you're not there yet. If you're just getting that contraction, great. And then we need to also do a very quick contraction of the pelvic floor. So this time we're not going to do the breath. I just want you to see if you can quickly squeeze that pelvic floor up and then let it go. So squeeze and go. Squeeze, go. People often find this a little bit easier. Squeeze, relax, squeeze, relax, squeeze, relax. Now remember, you're not clenching your bottom and moving up and down. It's internal. And then relax. So you're going to be aiming again for about 10 repetitions of quick squeezes. So we want to think about doing both of those. The way I work with my clients is just to really focus on getting them really, really high quality contractions with the exhale. Once we've got that moving and we've got that working and you can feel that pelvic floor, we then start to integrate it into bigger movements. So we start to do things like bridges and pelvic tilts and those sorts of movements, which are more towards clinical Pilates and clinical Pilates rehab and physiotherapy. So let's just do that standing up as well and just see what that feels like. Let me just bring up. Right, so, hang on, sorry. Let's go back to that. Right, so let's do it standing up. I'm hoping you can see me because I've got my camera set. Okay, so stand with your feet just underneath your hips, and I want you to imagine that you've got your rib cage stacked over the top of your pelvis. You're going to bring your hands around your rib cage again, and we're imagining this balloon deep inside of us. So we're going to take a nice inhale into the rib cage, relax the whole body. Exhale, Feel the ribs pull down, feel the abdominals tension, and see if you can get a little bit of pelvic floor lift at the same time. And then relax and let it go. Some people find it much easier in a standing position than a seated position. So it doesn't matter how you do them. If you find whichever position you find easier, this is where you do them. So we inhale again into the ribs, feel the ribs come wide. A little bit of breath into the belly and down into the pelvic floor. Exhale, the ribs come down. Feel the tensioning of the abdominals and feel the pelvic floor lift. Get that contraction. Back passage first, bring it round to the front to get the front passage and hold. 3, 2, 1, relax and let it go. And make sure you're not clenching your bottom or clenching your legs, everything else is relaxed, okay? So that's in standing. And then we can also do them on the floor. So you can lay on your side, you can lay on your back, whatever works for you, okay? Right. Let me just have a little look here. Okay, so let's move on to some, kind of what you now think of as more traditional core exercises. So I'm going to demonstrate these, so you'll have them on video. There's also a video which I've prepared which will be available to you, which is a pre-recorded video. But if you've got some floor space and you want to come down and have a try of some of these, I'm going to run through them now. So we've got a pelvic tilt, we've got some breath work lying on our side, and we've got a really simple bridge. So these are the things that are really, really important to begin with. So let's have a little go. I'm going to come down onto my back and you can join me if you like. So first things first, when we're coming down onto the floor, we need to make sure that we're coming down in a safe way, so we're not straining the abdominals and we're not placing pressure through the pelvic floor. So think about coming down sideways, and we want to think of having a little something under our head, a little cushion or a towel or something. So come down sideways and then we roll over onto our back. So we're not kind of pulling ourselves up and down using our abdominals and straining through the pelvic floor. So we're going to slide in this really comfortable kind of crook-lying position with our knees bent, feet flat, really relaxed. We're going to bring our hands to our tummy and we're going to see if we can feel that deep transverse abdominis muscle that runs around the front of the core. So find your bony hip points and kind of come into your tummy. I want you to sort of have a little poke around and just feel the muscles. So we're going to completely relax. So first thing we're going to do is do the breath with the pelvic floor contraction again and see if you can feel some contraction at the front of your body. So in these deep abdominals. So we take a breath into the ribs. We breathe out. Full exhale, longer, 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 longer. Feel like you're pulling up that pelvic floor up inside. Back passage first, then to the front. Get that contraction and hold. And you should feel, hopefully, the muscles in that abdominal wall, a little bit of contraction, and then let it go. Completely relax. So that co-contraction, what we're talking about here is restoring function, co-contracting synergy to that deep core, diaphragm, pelvic floor, abdominals. So we're doing it in standing, seated, or in this lying position. So let's try one more time. Inhale into the ribs. Exhale. Ribs come down. Keep exhaling, keep exhaling, keep exhaling. Bring the pelvic floor up, back passage first, front passage and hold. 3, 2, 1, and relax and let it go. So that is using the breath, purposeful exhale, to create pelvic floor contraction and a deep abdominal contraction, restoring function to the deep core. People often find that really difficult. Yoga background, or if you've never really done anything like this before, because it feels very, often feels quite counterintuitive and opposite to what you might think you need to do. The most important message though is that you breathe, you exhale to get the contraction. Let's try a little pelvic tilt now. It's going to bring a little bit of movement. If that was a bit tricky for you, this is going to help. Okay. So if you lie on your back with me, place your hands on your lower tummy. So you make a diamond shape with your fingertips and your thumbs together like this. Place them on your tummy. Relax your elbows down, relax your arms, relax your shoulders. I'm going to take an exhale, and I want you to imagine inside the diamond in your fingers, you've got a little ball, and it's sitting in the middle of the diamond shape. We're going to roll the ball between our thumbs and our fingers, so we get this little tilt of the pelvis back, and then release. So we don't want to create pressure, we want to create a tucking and scooping in feeling. So we need to do the exhale. So let's prepare ourselves. We inhale to start. And then we exhale and we roll the little ball towards our thumbs so our pelvis tilts backwards towards our face. So the pubic bone comes up and then release and back. Now don't make this movement too big. Try again. Inhale, exhale, little tuck back. So we're getting the feeling of scooping. The ball is rolling to the navel and then we release. Relax everything. Now, if this starts to really make sense to you, you can get a contraction of the pelvic floor at the same time. You will be doing it anyway because you're exhaling, but bring a little bit more awareness to it. So we inhale, we exhale, we roll the ball to the navel, the pubic bone lifts, and we get a little feeling of drawing the pelvic floor up and in. Release and relax. Good. What we don't want to do is press to the legs, make it too big or jam the back into the floor. We want to create a coordinated movement. So let's try 2 more. Breathe in, breathing out. We get the tilt. And then release. And again, inhale, exhale, tilt back, pelvic floor in and relax and let it go. Good. So that's a really basic pelvic tilt. So we're doing that lying on our back. We can do it on the floor, we can do it in bed. So if you're just post-surgery, if you're preparing for surgery, you can do this in bed after surgery, really gently, just a few repetitions, just getting that feeling of that little tilt back, drawing that pelvic floor up in the side. So this is safe to do this within days of surgery, okay? But if you've never done this exercise, this is where to start, because we're restoring function and getting that synergy back to that deep core. Let's take it up to a bridge. So this time I'm going to actually lift the hips up off the floor. So I'm taking my cushion from under my head because I want my head to be nice and aligned straight with my neck. So our arms are along the floor and we start with our pelvic tilt. So we inhale, we exhale, we tilt the pelvis and we start to peel up off the floor into a very gentle bridge, coming up and hold, everything's relaxed. Take another inhale at the top and then exhale as we lower down, 1 vertebrae at a time, keeping the pelvis tilted until the last minute. Let it go, completely relax. Now this pelvic tilt bridge, if it's done well, is one of the best exercises to coordinate the pelvic floor with the core muscles and the glutes and start to pull everything together. There are many exercises to do. This is one of the best. We inhale, let's do it again. We exhale, little tilt, tuck, feel the pelvic floor, lift up inside, lift a bridge and hold. Inhale, exhale, and slowly down. This is what we call a progression of that pelvic tilt. So this might start to come in maybe a week or 2 weeks after surgery, and once you feel like you've nailed that technique, we'll do 1 more. Inhale, exhale, we tilt, we peel up 1 vertebrae at a time, find our bridge, inhale, exhale to low, all the way down, relax, let it go. So that's really important. We don't rush. We make sure we've got that full relaxation phase. Now, to bring a little bit more awareness to the pelvic floor, you can use something between your knees. You can use a ball or a yoga block or even a folded towel. And just a little squeeze between the knees helps to contract the adductors, which attach into the pelvic floor. So this exercise now with something between the knees, exactly the same, is a really wonderful coordinated pelvic floor and core exercise. So we inhale, exhale, tuck. We've now got a little squeeze into the ball or a block or whatever. You've got a cushion between your knees. Hold. Exhale, lower. And then release and let it go. Okay, so I think I need to open up for some questions. Let me just wrap up with here with just back over here. Sorry. Okay, so that just shows you how we start with the breath, how we start with the diaphragm, how we coordinate the diaphragm and the pelvic floor, and then how we start to bring that into some more movement. So we want to get the diaphragm and the pelvic floor moving and restore function first, make sure the breath is correct, then we integrate it into movement. And it's super important always to be thinking about exhaling whatever we're doing, whatever movement we're going through, because exhaling offloads pressure off the pelvic floor, and that's super, super important. So these exercises here are what I would call very advanced Pilates exercises. And these are things that you would not start with, you would build up to these in time. And if you start with really well coordinated pelvic floor and diaphragm and core, deep core, you can move on to these much more advanced exercises. But these are exercises to move on to. And a lot of people will start here thinking these are beginner level, and they're not. They're really, really advanced. So thank you for paying attention to that. I hope that was useful.